Hi everyone, Dr. Daniel here. Today we'll be talking about acne as well as acne scars and what we can do to help improve those two conditions. So first and foremost, what is acne? Acne essentially is a medical term for pimples. So basically what happens is that when our pores get blocked, they become infected or inflamed, then we get pimples and get acne. Acne scars themselves, they are actually referring to a few kinds of damage to the skin. Quite often when we talk about acne scars, we mean either rolling, ice pick, or boxcar scars. But acne scars can also mean things like keloids or hypertrophic scars. And sometimes people also categorize changes in the skin color as also a form of acne scarring. So brownness happens when the skin reacts by creating more pigment. And redness usually is because of broken blood vessels that could leave little red marks. When we have active acne, there are two broad things that we are aiming to do. First and foremost, we want to reduce the skin's oiliness. And secondly, we are trying to reduce the inflammation or the bacterial load in the acne skin. So there are many things that we can do to help achieve these two goals. But broadly speaking, whatever treatments that we provide, we are aiming to either reduce the oiliness, clear out the pores, or reduce the inflammation and reduce the amount of bacteria in the skin. There are many different approaches to treating acne scars. In general, we are trying to stimulate new collagen growth to repair the damaged skin, and also we are trying to remove the damaged skin so that new skin can appear. We are also trying to reduce the amount of color changes that happen to the skin. So there are a few ways to do this. One of them is through chemicals, another would be through lasers, and finally, we are also able to use RF microneedling and also things like subcision and biostimulators that help to stimulate new collagen growth. So these are just some of the general things that we can do to help repair the scars that are caused by acne. So when it comes to acne treatment, how much improvement we can see depends on multiple factors. Quality of the skin in general, the severity of the scarring that we have, and also the treatment modalities that we use. Of course, younger skin tends to heal better. Also, if your skin in general is in better condition, hydrated, less sun damaged, and generally in healthier condition, they tend to heal better, respond better to treatment. Acne scar removal, generally for those things like brown marks and red marks, they tend to be quite permanent. Once they're gone, they're gone. For those that are caused by hypertrophic scarring, where there's a bump, there sometimes may be recurrence, but in general, people tend to get quite good results. For the dents, the amount of improvement that we see can be range anything from 50 to 70%, depending on the type of scarring, the severity of scarring. Some of these improvements do degrade over time because it's just a natural part of the skin to lose collagen as we age. Some of these improvements can be lasting, but in some cases there is a reversal. So acne and acne scarring treatments can be quite complicated. Usually multiple approaches are required and quite often can be very confusing when you try to sort this out yourself. So come on down and let us help you navigate through this jungle and try to give you the best results that we can.